and then you'll see the questions, and we'll read the questions together. We'll go through the answers, and we'll also do some imaging because students have difficulties with imaging as well. So be sure you go to my link. Be sure you go to my link on Clubhouse, and you will be able to find my YouTube channel. Hi, everyone. I'm going to reset the room. My name is Dr. Esiosa Aguidaro. I'm a neurologist and a neuroscientist. And today in this Clubhouse room, we're going to be doing neurology questions. Many of the rooms that I've done and talking to pre-med and medical students, one thing that they request is to do case-based questions because neurology is very high yield on the step 1, step 2, and step 3 exam. So that's what we're going to do today. We're going to do neurology questions, and we're doing this with Clubhouse and with YouTube. So if you go to my YouTube channel, you will see the questions that we're going to be going through together as a group. We'll read the questions together, and then some of the people will come up on stage and we'll talk about it. So everyone can come up on stage, and we can all take a poll to see what answer is right, and we can go through it. And will be doing some imaging. So be sure you go to my YouTube channel. Be sure you go to my YouTube channel by clicking on my Clubhouse link, or by going to my Instagram and clicking on the link there, and it will take you to the YouTube channel. And what I'm also offering is I'm going to be doing a lot more of these workshops, not only in Clubhouse, but also in Zoom. So if you want to sign up for those workshops, you can go to, there's a survey you can fill out that's on my Clubhouse link, and you can fill out that survey, and I will save you a spot for my neurology workshops. So with that being said, who wants to come up on stage so we can start answering these neurology questions that will show up on your exams? Any brave souls out there? Any takers? Don't be shy. The only way to learn is to practice. Anybody? I should get the Jeopardy song. I should be playing a Jeopardy song until someone comes up on the stage. You can ping your friends, ping your other colleagues to come up, and let's tackle neurology together. Is everyone able to see the live version, the live streaming version of this session? Or are people having difficulties? If you're in the audience, I'm going to invite you up. Everybody come up on stage.
Hello, doctor. How you doing?
Good. How are you? Thanks for accepting my invite to come up on stage. Oh, great. Good job. Thanks for accepting my invite to come up on stage.
I do want to say that I'm still in undergraduate, so I don't even know if I can really understand these questions.
Okay.
But yeah, I'll do my best, I guess.
Thanks. Yeah. Wow.
Also, what I want to say was your YouTube is on and I can hear it, but it's only delayed, if that makes sense.
Oh yeah.
I don't really see anything. I just hear you, if that makes sense.
Yeah, it'll be 10-second delay, but can you see where it says neurology review for medical step exam? Can you see that?
Yes, I
okay.
do. Yes,
awesome.
I do see that. Yep.
Awesome. Yeah, there's a little bit of delay. That's just how YouTube and Zoom work together. Cool. So what you could do, if that's problematic, you could mute the YouTube, because really for people who are in the Clubhouse room, what you guys want is the visual. So if you mute the YouTube, you can still see the visual and you won't get that delay.
Yeah, that's what I've been doing. So the YouTube is muted, but at least I can see.
Yeah. Awesome. Okay, great. And make sure you ping your friends into the room. The more the merrier, and we will get started soon. While we wait for other people to come, are there any topics in particular that you all struggle with in neurology? You guys are a quiet group. There's 3 people
Yeah,
in
I can't really answer.
That's okay. Yeah.
So I accepted your request more to say that your YouTube is working, if that makes sense.
Oh, cool.
Because
Thanks.
I can't really, because I'm not in med school yet, so I can't really say. I was just interested in like hearing what the questions were gonna be. So I was just here to like kind of vibe with you guys.
Cool. Well, welcome.
What is about? So.
Yeah, you're getting a head start. Good for you. What about the other people in the audience? We have 3 people in the audience. I invited you guys to come up and speak. I'm going to send you guys another invite. Let's get to know each other.
Hi, Dr. Sosa.
Hi.
So I am interested in the blood-brain barrier. I'm also kind of still pre-med, but that's always been a topic I've been highly interested in. How does that work?
Awesome. Good. The blood-brain barrier. Very great question. I will put that. I also have a running list of questions that people ask or that people are asking me in different rooms. So I'll keep a running list. And when I get enough questions on a particular topic, I just make a workshop out of it. So we have 2 new people in the room. So I'm gonna introduce myself. My name is Dr. Esio Sikadaro. I'm a neurologist and a PhD trained neuroscientist. And I do a lot of clubhouse rooms talking about different aspects of clinical medicine and also neurology and neuroscience. So per request, several students wanted me to start doing question-based rooms so that they can tackle some of the neurology questions that show up on step 1, step 2, step 3. And neurology is very high yield in all of the step 1, step 2, step 3 exams. It's up there with GI and pulmonary and cardio. So it's really good to be able to master neurology because then that will help you with your exams. Okay, so anyone that's new, feel free to come up on stage. There's an interactive portion for this workshop. If you go to my Clubhouse bio, you'll see a link that will take you to all my different social media platforms. You want to click on the YouTube channel, and that will take you to the interactive portion because I'm going to be showing questions and we'll be going through those questions together. These questions are not copyrighted, so they're available for free online, and we can, discuss these questions for educational purposes. And we will also be doing some imaging as well, because that's a topic that many students struggle with. So let's get started with that, and make sure you ping your friends, you ping other colleagues, come up on stage. I don't bite, and we'll have a grand old time. How does that sound for everybody?
Sounds good to me.
Awesome.
Sounds good to me too.
Cool. Okay, let's get started. So can everyone see the first question?
So as I said, it's a bit delayed, so I don't see anything yet, but it should come up soon.
Oh, fantastic. It came up. Awesome. So who would like to read the first question? I'm going to just invite everybody that comes into the room on stage so we can all participate. Who would like to read the first question?
I'll go for it.
Yeah, go. Good job. Go ahead.
Sweet. Question 1. An elderly man is brought in by the family because he is feeling down. He is confused, has difficulty remembering recent events, and has urinary inconsistence.
Close. Incontinence.
Incontinence. Thank you.
You're welcome.
He appears indifferent to his problems. On examination, his gait is ataxic. But there's no noticeable tremors or rigidity.
Very good. Very good.
Sweet diagnosis.
Yeah, great. Thank you for volunteering. Thank you for reading that question. So many students wanted to understand, how do you approach these questions? So let's break it down. So we have an elderly man who's brought to the family because he is feeling down. So when you hear that, what are you thinking about? We can break it down part by part. So you have an old man brought brought in by his family because he's feeling down. So what are some of the thoughts or diagnoses that come to your head when you see that word?
I'd assume depression is something to think about.
Yeah, good. Yep. That is exactly what I would say. Looks like we have another neurologist on the stage. Would you like to introduce yourself?
Hi, can you hear me?
Yeah. Thanks for coming up.
It's really my first time speaking in Clubhouse, so please bear with me here.
Oh, you're doing great.
Thanks so much. I am actually a chiropractor that has my diploma in neurology, and I thought it would just be really fun to join in the room and do some good review this evening.
Yes, thank you for being on stage, and we can tag team and teach the students about all the phenomenal things in chiropractic. Is it chiropractic? What's the noun form? The study of chiropractic neurology.
Correct.
Awesome. Thanks.
Now, could you please tell me too, so I don't interrupt, how to mute my microphone when I'm not speaking?
Oh, so if you look at the bottom where it says leave quietly, then there's like a plus sign and there's like a microphone sign.
Okay.
If you press the microphone sign, that will mute you.
Great. Thank you so much.
Yeah, and welcome to Clubhouse. How long have you been on Clubhouse?
I have only been on it about a week, and I listened in a little bit the other day. Actually, another one of my colleagues that's a friend invited me on. So hopefully there'll be a little community of us from our specialty soon on.
Nice. Cool. I have been on here for a couple of months, and it's phenomenal. So we did great with feeling down. So now it says he's confused and he has difficulty remembering events and urinary incontinence. So when you think of confused, let's break it down. When you think of confusion, what is that? What comes to your mind, especially in the old patient?
They're kind of like Alzheimer's, not Alzheimer's per se, but like dementia.
Yeah.
Alzheimer's. So that's why I looked at the answers. I was like, well, to me, it could be depression and Alzheimer's dementia. So I do wonder how you like. I feel like the urinary incontinence probably has like, it's probably like the definitive one that actually like picks one over the other. So I think people with depression have urinary incontinence.
Good. I love your testing strategies. How it's like, okay, you see the, feeling down, you think depression, you think, oh, okay, this patient's confused, the patient's elderly. So then you're thinking like a neurodegenerative process, maybe dementia. But then you see the answers. Well, there's depression and there's dementia. So it can't be both because, you step U-world, there's only one right answer. So it's like, well, how do you narrow it down? And you narrow it down by there's other clues in the question that will point toward one more so than the other. So good. So then we'll keep reading. So now he also has urinary incontinence. And like you mentioned, which one of those, fits more of a urinary incontinence type picture? And sometimes what I like to do is I read the question and I don't even look at the answers first. I think of, okay, what do I think it is? And then I look at the answers. And then I see the answer that I thought in my head, is that what I see on the multiple choice? Because sometimes what will happen is the board exam will put a really, really good answer that's very attractive and everyone wants to pick it. But if you don't read through all the answers and you get attracted to that one good answer that's the wrong answer, then you'll, that's how you miss questions. So what I've recommended and what other people have recommended to me, and it works, is read the question first without looking at the answers, figure out what's going on. What do you think? You can do this within a matter of seconds. And then once you think, oh, okay, I've read everything. This is what my differential is. This is what I think. And then you look and see, okay, which of the following multiple choice answers fit what I'm thinking? Does that make sense?
Yeah, it does. Thank you.
Okay, cool. No problem. So there's urinary incontinence. We're still trying to figure out, okay, where do we put this? And it says that he appears indifferent to his problems, meaning that he doesn't really have insight into what's going on with him. So now we get to some of the key findings that will help. So he has an ataxic gait, which means that he walks, his walk is abnormal. It's more like his balance is off. He's not able to, maintain good balance when walking. But he doesn't have any tremors or rigidity. So when you think tremors, what's the diagnosis that comes to your mind? Tremors and rigidity in an elderly patient.
I want to say Parkinson's.
Yes, very good. Parkinson's disease. So they told you right there, he doesn't have Parkinson's because he doesn't have tremors and rigidity. And tremors and rigidity are criteria for Parkinson's disease. Okay, good. So now we were thinking maybe depression, maybe dementia of some sort, still trying to figure out what we're going to do with this urinary incontinence. Now that we have that, and then also how are we going to add on this a weird walking, it's ataxic gait. Now that we have that, let's start looking at the answers. Okay, so let's take, do you guys want to take a vote, or do you guys want to talk through each question in your head? How do you guys want to do it? Well, this is the first time, so what we can do is everyone have an answer in your head, and then we'll walk through it step by step. And then in the future, when you in my workshops, we'll be doing polls, and then we'll be able to see what everyone else is thinking. Okay, so Alzheimer's disease. Alzheimer's disease is a neurodegenerative disease, and it's the pathology of Alzheimer's disease is plaques and tangles. And one of the more typical presentations of Alzheimer's disease is difficulties in short-term memory. Pick's disease it's also known as frontal temporal dementia. And in Pick's disease, people have issues with behavior. Their frontal cortex is really involved. So they have abnormal behavior, they're inappropriate, they have hypersexuality. That's Pick's disease. And we all know depression. Do you guys know Sicky caps, where there's certain criteria to fit depression, and depression presents with nausea, vomiting, guilt, sometimes homicidal, suicidal ideations, hopelessness, things of that nature. And you have to meet the criteria and have so many of the symptoms before you meet a criteria for for depression. And the normal pressure hydrocephalus. So normal pressure hydrocephalus means that there is a lot of buildup, a lot of abnormal CSF fluid in the brain, but there's not necessarily it's not causing high intracranial pressure. So some of the symptoms of normal pressure hydrocephalus, a mnemonic that gets taught in medical school is, I think it's wacky, wobbly, and wacky, wobbly. Does anyone remember the other one?
Wet.
Thank you. Awesome. Wet, wacky, wobbly. So that's a mnemonic for normal pressure hydrocephalus. So now that I've given you guys that information, what do you guys think the answer is?
I think Judith hit it right in the head the first time. I think dementia should be at least is my guess.
Okay, so you're guessing dementia. Okay. Anybody else?
I think it's a normal pressure hydrocephalus.
Okay, and why do you say that?
Because it really just the wet part is the urinary incontinence. It seems indifferent, and the wobbly part is the Ataxic Gate. Yeah, I was thinking the same thing. I thought it was normal pressure hydrocephalus as well. Just because everyone can feel down, that doesn't necessarily mean that that's like the main reason for a diagnosis, if it makes sense. I feel like the other ones are just more, I feel like they're more, it fits more the normal pressure than the Alzheimer dementia.
Very good. Very good. So then I agree Normal pressure hydrocephalus fits more. Good. Alzheimer's disease, it fits the difficulties, remember recent events, but urinary incontinence and then the abnormal walking really doesn't fit with Alzheimer's disease. So that's why that's less likely. So we'll do 5 of these just to kind of give you guys a feel for what are the type of things that I do in my workshops. And if you want to sign up for these workshops, you can go over to my Clubhouse link and sign up for the workshop there, or you can go over to my Instagram, click on my Instagram link, fill out the survey, and then you can also sign up for my workshop there where we go in more detail with questions and imaging, and it's all free. Okay, so now that we've done question 1, who would like to practice with question 2? And you guys can do it as a group.
I don't see anything yet because of the delay, so I'll just wait for a bit.
Cool, cool. Is it? Yeah, it's usually like a 10-second delay. Do you see anything now?
Yes.
Awesome.
So, you want me to read it, you said?
Yeah, and you guys, I will keep quiet, and then I want you all to speak, and then when you have your final answer, let me know, and I will click it.
So question 2, which of the following medications has the least anti-inflammatory properties? You have acetaminophen, ibuprofen, prednisone, and aspirin, I want to say. I hope I said it right.
Yeah, good job, good job.
Those 4. So yeah.
Okay, so let's say this was a test and you guys could only pick one answer. So I want you guys, everyone, to unmute their mics and discuss and let me know what your final answer is. Okay, I'll help out. So acetaminophen is Tylenol. What do we use Tylenol for?
Is it for muscle aches?
Yeah. Yep. People use it for pain, muscle, joint. People use it for pain. Yeah, very good. Okay. What about ibuprofen? What do people use ibuprofen for?
Headaches.
Exactly.
That's what I used for. I don't know if it's
yeah, good. It's an NSAID. So people use that for, to treat pain, to treat headaches. And what about prednisone? That might be more of a harder one. So prednisone is what we call a steroid, and it's to reduce inflammation. So in people that have like autoimmune disease or when their antibodies attack the body, we, tend to give them steroids because it helps reduce that inflammation. And then aspirin, we all know aspirin. Aspirin is, it's a blood thinner, and it's also a NSAID as well. So an NSAID is a non-steroidal anti-inflammatory drug. So with that basically rules out. So with that comment, what do you guys think is left? Or what do you guys think the answer is?
I don't know which one it is. I think it's one of 2. It could either be acetaminophen or aspirin. I'm stuck between these 2 because I know and I forget which one between the 2 is used as a treatment option for cancer patients. So I'm guessing anti-inflammatory would be very good for people with cancer. Actually, would it be very good? Because maybe you do want the immune system to be activated if you have cancer. I don't know.
No, but I like how you're thinking, and it's all about testing strategy, because when I take an exam, I don't know every question. I don't, but I try, okay, if I don't know this question, how can I narrow it down? So I like how you said well, I know it's not ibuprofen. I know it's not prednisone, so I rule that out. So now I'm stuck between Tylenol and aspirin. So that's a great testing strategy. And these are things that you could use when you approach these exams. And, these are all, good testing strategies to, kind of help move along and increase your chances of success on the exam. So great. So you're right. Ibuprofen is an NSAID, so has anti-inflammatory processes. So does prednisone, and aspirin is also an NSAID as well. So it has anti-inflammatory properties. So if that's the case, then what medication is left?
Acetaminophen.
Exactly. So acetaminophen of all these medications is the one that has the least anti-inflammatory properties. Very good. We're going to skip 3 because 3 is a hard question. We're going to skip 4. That's also a hard question. So is 5. So is 6, 7, 8. Okay, let's do 9. And I'll wait for it to come up on YouTube. So the goal of my workshops that I'm going to be doing is to teach you guys how to use testing strategies to narrow down their answer choice. And then when you have narrowed it down, try and figure out, okay, what do I know? And can I use what I know to get to the right answer? And then also talk about, interesting things in neurology from a practical high yield standpoint that will show up on your exams as well. Okay. So can everyone see question 9?
Oh, yes, we can see it. Sorry.
Awesome.
I can see it now.
Awesome. So who would like to read question 9 for the group?
I can read it.
Thanks. Go right ahead.
Number 9. Which of the following is the most important measure for pressure ulcer prevention in a patient that is paralyzed? The first choice is egg. Sorry, it's kind of difficult to read. The first choice is egg. I don't think my video is loading that well. I can't really see the.
Oh, the first one is egg crate.
The second one.
Yeah, go ahead.
No, I think it's because the quality of my music video, I can't really see the letters that well.
Oh.
Mattresses?
Yeah. Yep.
Yeah. Oh, and then the second one is repositioning and something every 2 hours. I'm sorry. Thanks for volunteering.
Thanks for volunteering. I appreciate it. So it's repositioning and turning every 2 hours. And then I'll help with the others. Adequate nutritional support.
Thank you. I'm sorry.
No problem. And massage every 4 hours. So that the answer choices are egg crate mattress, repositioning and turning every 2 hours, adequate nutritional support, and massage every 4 hours. So what do you guys think? Let's start narrowing down wrong answers first. So what answers do you guys think is completely incorrect? First of all, what are pressure ulcers? That doesn't sound good. Anything with the word ulcer in it doesn't sound good.
So I'm guessing a pressure ulcer is what happens, for example, if you're paralyzed, you're sitting in one position for extended periods of time. So pressure ulcers are kind of these ulcers that come about from putting pressure on one spot for an extended period of time.
Exactly. And the reason why that's bad is because when you have pressure on one spot, eventually will lead to decreased blood flow, and you don't have blood flow, then it will lead to decreased nutrients get into that area, and oxygen and glucose, and then it will start to become ischemic, and the tissue will break down and start to die off. So that's why pressure ulcers are not good, and you want to prevent as much as you can, especially in patients that are immobile. So of the following answers, which of the two can be eliminated off the bat?
Honestly, accurate mattress, it just doesn't sound very reasonable.
Yeah, exactly. That's what I thought. I was like, that doesn't make sense. Like it's off. I've never heard that before. It doesn't make sense. So we're gonna cross it out.
Yeah, it's really weird. Like,
yeah. Exactly. Good.
And also adequate nutritional support. Just because we were talking about how like long periods, like sitting in one position for long periods of time cause pressure ulcers. So your food would have nothing to do with that type of action, if that makes sense.
Very good. See, yeah, testing strategy. And that's a great example of a testing strategy. So I know what a pressure ulcer is. So if I want to prevent the mechanism that's causing a pressure ulcer, will any of these options do that? Nutritional support, that's not affecting the pressure. Egg crate mattress, no, that's not really going to help the pressure, because if the patient, that's not going to alleviate the pressure. Good. So that means we're left with massage and we're left with repositioning. So what do you guys think it is?
May I take a guess? May I take a guess?
Yeah, of course.
So in my CN experience, it was very critical for us to change the position of the patient every 2 hours minimum, or as often as possible. So to get pressure off of the particular position the patient is sitting in, you want to change their position as often as possible.
Very good.
Extra positioning every 2 hours.
Very good. And I like how you pull clinical experience to help answer some of these questions, because I've been taking exams. I'll sit in the exam hall and I would have never read it, but because I remembered it from my clinical rotation, I was able to answer the question and then move on. So know that sometimes the answers will not come from the book. You just have, you're learning always, and making sure you're taking in as much as you can in the hospital setting, especially when it comes to the more ethical questions that comes with being in the hospital and seeing patients and just paying attention to what's going on. Great job. Question 10 is also a little bit of a harder question, so we won't do that. So I just wanted to give you guys a taste of the things that I do in my workshops that I'm starting. So if you're interested, if this was helpful for you, these are the kind of things I'm going to be doing with clinical questions, with imaging. So be sure you sign up. You can sign up on my Clubhouse, use my Clubhouse link, and then my Instagram link as well. And we'll be, I'll do maybe 10 to 15 students per session, and we'll, just go through questions, and we'll have fun and we have a great time. So be sure you complete the survey, you invite your friends to also complete the survey, and we can start getting some of these interactive sessions up and going. How's that sound for everybody?
This is great.
Awesome. Fantastic. Well,
as students still, I would be all about this. This is hugely helpful for board exams if you're going to be taking a board exam. That's what you need, that's for sure. I'm curious, are you going to do any more advanced type topics? I know I would be really interested in doing something, that's for sure, especially as a newer clinician, where a lot of my colleagues and I just aren't practicing as much right now and getting that really necessary early on clinical experience like we should be because of the pandemic. It would just be great to have an avenue to keep learning even more and interact with others.
Yeah, if you send me an email and if you send me some topics that you are interested in, I could take a look. So I'm a second year resident, so I'm 2 years into my neurology residency. So if it's something that I know well, I'm happy to lead the workshop. And then if I'm not comfortable yet, then we'll just, wait a couple of years until I know the topic, and then I'm happy to lead the workshop then. So yeah, send me an email and let me know what types of topics you are interested in learning more, and I can see what I can do. Awesome. Anyone else have any questions? Okay, great. Well, thank you so much for being in this room and participating in the audience. I really appreciate it. And I look forward to seeing you guys, in my upcoming workshops. I'll also continue to do.
Dr. Phyllis, did she ever answer your question? Because I think she's still muted. So.
Oh, I'm still muted. How long have I been muted? That's hilarious.
Like a minute.
Oh my God, I was talking. Oh my goodness. Dr. Phillips, did you hear my answer to your question?
You didn't hear anything. No.
Oh, I'm sorry. Okay, so sorry about that. So I'm a second-year resident in neurology right now. So I'm, fairly new in the neurology training. And so if you're looking for some advanced topics, if you could send me an email about what topics you're interested in wanting to know more about, and I can see if I'm comfortable teaching that at my stage. And if not, then, I can always revisit it in a year or two. And if I am, then I'm happy to lead a workshop in that. So just send me an email and let me know what topics you would like more knowledge on, and I can see what I can do.
That would be fantastic. And I'm just all about the interdisciplinary collaboration too. So it's just great to interact with a medical neurologist yeah.
Awesome. Me too. Yeah. That'd be fantastic. Awesome. Anyone else have any questions or suggestions?
Yeah, I was wondering because Dr. Ishiosi, you have published, and you've been a part of some research.
Mm-hmm.
And I was wondering if I were to read out, would you be able to answer some questions I have about those research projects you were on?
Of course. Wow, that's impressive. Yeah, if you take a look at those papers and you have questions. So I'm doing two things right now. I am hosting interactive teaching clinical sessions, and I'm also doing one-on-one like office hours for 15 minutes. And if you want one or the other or both, go to my link that's on my Clubhouse and also on Instagram, and you can fill out both of those surveys. And then in the question where it says, what would you like to talk about? You can say, I would like to talk about some of the papers, and then put which paper you read and that you want to talk about. And I'm happy to talk to you about some of those papers.
That would be great. Yeah, I already followed you and everything, so I should be able to find it. Thank you.
Awesome. No problem. Yeah. And if you're interested in writing I do a lot of projects. If you're interested in wanting to write a paper in the field, send me an email, and I'll keep you in mind when other projects come up. And if you're interested, we can write a paper together.
Yeah, that'd be great. Thank you so much. I'll definitely reach out.
Fantastic. Very good. Well, I want to thank everyone for being in this room, and if you want to keep up with other rooms that I do here on Clubhouse or on YouTube or Zoom, be sure to, follow me on Clubhouse, follow me on YouTube, especially, because then you'll get a notification every time I do a video or upload another video. And I look forward to seeing everyone in the future room. Thank you very much, everybody.
Thank you. Good night.
You too.
Thank you so much.
Thanks.
Thank you so much.
You're welcome. Bye.